Hi, I'm Dr. Daniel McDyer of Florida Women Care of Jacksonville, and I want to take a few minutes to share with you the answer to a question that I am frequently asked: why I became an OB/GYN. It's really a great question, and actually becoming an OB/GYN is one of the last things that I ever imagined would happen. Why? Because I thought that the idea of delivering babies was undesirable, and I had a very limited understanding of what the specialty involved. Also, as I was growing up, I had a neighbor who was a doctor, and I always used to hear him drive away on his moped late at night. I later found out that he was an OB/GYN, and I thought that the idea of being called away from his home at all hours of the night was absolutely crazy. Even though I loved working hard, that seemed absurd. So, entering medical school, I pretty much had OB/GYN scratched off of my list of potential interesting specialties. In my first 2 years of medical school, it was difficult to develop any specific interests because they consisted of 40 hours a week of classroom teaching to get all of the fundamental knowledge of the body's anatomy, physiology, cellular functions, and chemistry, and to begin to learn how medications could affect disease processes. At the end of the second year, our class was separated into 12 groups of 8 in preparation for our third year of medical school, which is when we finally had a real chance to start learning how to take care of patients. The third year was broken into 2 6-month segments. One 6-month segment consisted of 8 weeks each of OB/GYN, pediatrics, and psychiatry. The other half of the year was 12 weeks of surgical specialties and 12 weeks of internal medicine. In order to determine the order of our rotations, we held a lottery. I was pretty certain that I had no interest in OB/GYN, so I petitioned the other 7 in my group to choose OB/GYN as our first rotation if we had the chance, because I thought that the new OB/GYN residents would be just starting their 4-year training program and would probably have limited opportunities to do deliveries and other things in which I thought I had no interest. Well, as fate would have it, we ended up getting psychiatry first, which I thought was really exciting, probably because it was the first time I had a chance to contribute to patients' care. That was followed by my OB/GYN rotation, which was not looking forward to. A classic case of judging a book by its cover and prejudging things with incomplete information. Just a few days into my rotation, I quickly realized that this was an extremely exciting and interesting specialty. My first delivery, which I had previously hoped to never participate in, had a big impact on me as I could not believe what a privilege it was to witness the miracle of a newborn baby's first breath while I was delivering her. It was truly awesome, and I could not wait to deliver my next. The placenta, well, that's a whole different experience which you can ask me about later. I truly enjoyed every other aspect of the specialty, and I also discovered that women were a lot easier to care for as compared to men because they seemed more open to discussing their problems. At the conclusion of this rotation, I thought I'd probably discovered my future, but I kept an open mind to experience all of my other rotations to see how they influenced me, especially since this experience was the complete opposite of my expectations. I really enjoyed my other rotations, especially surgery, even though I had a brilliant but crazy chief resident who worked us about 130 to 135 hours per week for 6 weeks straight, which is an entirely different story. Anyway, at the conclusion of my third year, I evaluated all of my interests and found that OB/GYN was by far and away my favorite specialty. Why? Because I found that OB/GYN allowed me to use a lot of the information that I learned in the rigorous first 2 years of medical school, and it provided the opportunity to deliver babies and do surgery, both of which I truly enjoyed. Another major bonus was that it would allow me to provide care for my patients for a large portion of their lives, which was important to me because I love learning about people, and I enjoy having the opportunity to witness how my medical care impacts and improves my patients' lives. Finally, the OB/GYN residents were by far and away the happiest residents that I met the whole year. Thereafter, in order to prepare for my 4-year OB/GYN residency and the rest of my career, I spent my 4th year of medical school focusing on OB/GYN rotations and learning a bit more about other specialty whose skills might benefit me and my future patients through monthly rotations in those areas too. I feel incredibly fortunate that my journey to a career in OB/GYN resulted in a career that is both challenging and extremely rewarding, and that I truly enjoy. Thank you for your confidence in me and my partners and for helping provide a strong sense of purpose in my life.